Hello. Welcome back to the planet's premier medical cannabis education channel, unabashedly sponsored by the University of New Mexico's Medical Cannabis Research Fund. Thank you for joining us. Now, today I want to talk about a topic that we discuss in class. Again, I teach medical cannabis research classes in addition to doing the direct work on different levels and so forth. But I'm often presented with the question of the distinction between recreational cannabis use versus medicinal cannabis use. Okay, so this is a distinction that's in a lot of patients' minds because they don't want to use it recreationally. They've been conditioned to believe that that is somehow morally, horrible, and that you're a bad person if you engage in cannabis usage for recreational use. And ultimately, they want to be able to justify the effects that they experience, even mood elevation in terms of its medicinal context, right? But I'm also presented with this dichotomy from reporters all the time. So, how do I anticipate policies to unfold that limit recreational use but maximize the potential for medicinal use and so forth? Okay? Now, at the heart of this conversation is really a semantic representation and, unfortunately, a historical moral loading of this distinction between medicinal and recreational usage. And this is a hypocritical situation that essentially is very similar to other types of terms that are used with regard to cannabis usage. That is the term being stoned or being high. Now, these are concepts that, again, we've been taught for many generations now are absolutely atrocious, and they're reflective of being of terrible character and so forth. So we don't want to engage in being high. But in actuality, objectively, being high is just feeling good. So essentially, that's just an improved visceral quality of life or subjective well-being, right? So that's one part of it. Patients don't want to be high. They don't want to be doped out. They don't want to be using pot because pot gets you stoned, right? So they want to clearly distinguish their responsible usage from what we were told was morally horrible and reflective of terrible character and so forth, right? We also have this notion of really a false dichotomy with regard to this distinction as it applies to cannabis, where it's really not applied to any other types of behavioral interventions that we engage in, right? So whether they're recreational or medicinal. So for some reason, we're always talking about the distinction with regard to cannabis use. We don't talk about the distinction with regard to alcohol use, but more so, we don't talk about the distinction with regard to other types of things that we engage in every day. So if you're like me, you tend to pound a whole bunch of coffee in the morning, right? And I drink coffee seriously till like mid-afternoon. I don't even eat until mid-afternoon, just nothing but coffee. And, I'm carrying around my big old cups of coffee, running from class to class or meeting to meeting or whatever I have to do that day. And nobody's asked me if I'm drinking my coffee for recreational purposes or for medicinal purposes. In fact, when I bounce that concept back to people, they look at me really perplexed in that, you can make the same type of argument in that, right? So maybe I'm using the coffee for just getting high or for some kind of self-fulfillment that is unnecessary because I don't have a medicinal need to be drinking that coffee or to feel more awake or energized or focused or whatever I anticipate the coffee is going to result in. Or, this distinction of using it medically. Nobody talks about medicinal use of coffee. We just drink coffee. And oftentimes we do it in public. Sometimes even in group meetings, everybody's drinking coffee. And, nobody's trying to point fingers and claiming that we're using it irresponsibly or whatever. A similar analogy would be exercise, right? So those of you that exercise are never asked whether or not you exercise for medical or for recreational purposes. And obviously, we exercise for a whole bunch of purposes, right? But the point that I'm trying to make here is that when it comes to cannabis, we've allowed some of these arbitrary means to infiltrate our common sense. Now, there's a lot of work out there that suggests that cannabis usage is an effective preventative health intervention for many different types of chronic illnesses. And we'll be talking about all that stuff. So if, in theory, cannabis has any preventative properties, then all usage is medicinal. Likewise, If cannabis tends to make patients feel better, then all usage is recreational. And the point that I'm trying to make is that there's no distinction, and there should not be any distinction between the two. Ultimately, if cannabis improves the individual's subjective well-being and quality of life and behavioral functioning, well, ultimately, it's a case closed, and it's a success. That is what we have been responsible for providing to our patients and to people that rely on our objective research findings. So we have successfully helped people if we allow them to get high, or maybe even feel stoned. Either way, use it medicinally, use it recreationally, but please use it responsibly. We'll see you next time.